Hello everyone, today's video is about the heavy metal content in biofilms and how those can be addressed, and also about the best types of nasal sprays to use in my clinical experience. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So a couple of questions came in on some of my other videos and they go a little something like this. I'm using Dr. Paul Anderson's Biofilm Phase 2 Advanced by Priority 1. It has bismuth, alpha-lipoic acid, and black cumin seed. My biofilms are out of phase 2 at this point given the length of time I was exposed to mold, and I came off itraconazole for fungal colonization and my symptoms came back within a few weeks. I've tried NAC and oregano oil and they do not work. I'm not strong enough. Question, will this supplement alone address the heavy metals in the biofilms, or should EDTA be incorporated? No access to the prescription for it, so doing supplement/herbals on full script. For example, I could also take SFI Therabiotic Interphase Plus, which has EDTA along with the Phase 2 Advanced. Is the EDTA needed? So great questions. So just for point of reference, Dr. Paul Anderson, a brilliant naturopathic doctor from Washington. He's been in practice for, I don't know, over 30, 35 years, something like that. He's been at it for a really long time. I've done many of his courses. Brilliant guy. He has a very prolific YouTube channel, maybe on other social, I think he's on Instagram as well. Anyways, really worth following his content, I think. The Phase 2 Advanced, I guess to my understanding, it is good at helping to break down strong, like Phase 2 biofilms, hence the name. However, I don't honestly know how effective the bismuth alpha-lipoic acid diethyl complex is at helping to get rid of heavy metals. I know that the formulas that we use, which include, EDTA or DMSA or DMPS, they have actual chelators in them. They're definitely good at removing heavy metals. I can vouch for that to the ends of the earth because we've used so much chelation therapy to remove heavy metals from the body. They're very, very, very good chelators. They're well-established agents at doing that. How good is alpha-lipoic acid and bismuth at removing heavy metals? Not so sure about that. Maybe there's some research literature out there looking at that. I haven't seen it. If anybody watching has seen that literature, I'd love to take a look at it. Please post a comment about it. So I guess what it comes down to is, to my understanding, the Phase 2 biofilms are polysaccharide proteinaceous compounds that also have heavy metals incorporated within them. And the way I conceptualize it is that the heavy metals almost provide like a metallic scaffolding for the proteins and the sugars, the polysaccharides, to build upon. And so it just makes a much stronger barrier. So, if you were going to make a wall just out of bricks, to around a city or something like that, like that's pretty strong, but, with a good battering ram or a cannon or something like that, I don't know, you can like blast a hole in that, without too much difficulty, I suppose. Whereas if you have like iron girding within there and there's like an iron mesh framework that's, built within the bricks, like that's going to be a lot stronger. So I believe that the Phase 2 Advanced will, or the Biofilm Phase 2 Advanced will break down the Phase 2 biofilms effectively over time, but I don't know that it's because it's going to actually chelate and remove the metals. It may be more that it's helping to kind of dismantle all the bricks, and then I guess this is where the analogy kind of falls apart a little bit, but let's just assume that like the brick infrastructures needed for the metals to kind of have something to structurally incorporate with. So it's almost like the metals and the proteins and polysaccharides kind of play off of each other. So I think that they will, what I've seen with other patients, because I don't prescribe the Biofilm Phase 2 because I have fairly easy access to the bismuth alpha-lipoic acid diethyl complex plus DMSA. We used to use DMPS, then DMPS went up crazy high in price, switched to DMSA for pricing reasons. It seemed to work just as well, so we just stick with the DMSA. So that's what I've used for years and years and years. It works really well. Patients of mine who have seen other clinicians or they live far away, anyways, they can't access the prescription version for whatever reason. I have seen good results with it over time. I just really can't speak to what's happening on like a molecular biology level in terms of it actually, binding up metals and removing them. So clinically, it seems to work. It just seems to also take longer. I've heard other clinicians say similar things, and so it seems that the collective clinical experience, at least in my bubble that I exist within, that it seems to be effective, just it can take longer. In terms of the question around, is it a good idea to bring in EDTA? So with EDTA, the only time that I personally, like in my practice, use EDTA for biofilm disruption is if we're using it as part of a nasal spray, because the EDTA can go right up the nose and break down those biofilms. So when there's, say, a mold-related biofilm and we're spraying stuff up the nose, then the EDTA, that's great. If I'm worried about systemic biofilms, so biofilms from Lyme or co-infections, that's where I'm not going to use EDTA, because to my understanding, EDTA is very, very, very poorly absorbed across the intestinal barrier. So it's not going to go systemic the same way that DMPS or DMSA will. Now, if I have a patient with intestinal biofilms, then sure, EDTA could be helpful. I just don't use it. I use the DMSA version, but on paper that would make sense. Then also, if there are patients where we suspect bladder or urinary tract biofilms, then again, EDTA being so poorly absorbed intestinally, so it's not going to get into the bloodstream, therefore the kidneys are not going to filter it out, therefore it's not really going to get to the bladder and the urinary tract. Again, that's where DMSA or DMPS would be better choices. Now, the bismuth, alpha lipoic acid dithiol complex, that should get systemic. That's my understanding of it. So that could work just great. But yeah, in terms of actually getting a chelator into the mix, EDTA, to my understanding, is only really going to work if it's going up the schnoz or it is for intestinal biofilms. So I think I covered all that. If there's any outstanding questions on that, just post in the comment section and I'll answer further. The other question that came up on a different topic, although, well, I guess loosely related, is about nasal sprays. So it says, can you talk about over-the-counter pre-made types of antifungal nasal sprays that work well, or if it's a waste of time and money using them? Also, is bee propolis and manuka honey sprays worth it? You should make a video showing how you make the nasal sprays in practice for your patients. All this info would be helpful. Yeah, Dr. Jill Krista, another naturopathic doctor from down in the States, she has a YouTube video that goes over how she makes nasal sprays. The way that I use nasal sprays is heavily inspired by her. So when folks want a demo of people making nasal sprays, I just say, look up Dr. Jill Krista, just JILLCRISTA, and nasal spray, and plug that into a YouTube search box, and it should come up. She's an expert in mold illness and also in pans and pandas, and she knows about lots of other things too. She has been on my Overcoming Chronic Illness podcast a couple of times, and she's amazing. So any clinicians who are listening, she has an amazing clinician training course in mold illness and pans and pandas, and she's awesome. So there's that reference or resource. As far as over-the-counter pre-made nasal sprays, honestly, I don't really use those ever. I always ask my patients to either get a compounded nasal spray, so one that, say, has EDTA in it. There's this product called BioBreaker, which I can't actually remember who developed it in the first place. I think I might know, but I don't want to misspeak. So anyway, it doesn't matter. Well, it matters, but I'm not going to say because I'm not sure for sure. But anyways, it's a combination of EDTA, iodine, grapefruit seed extract, and xylitol. So it's a really nice combination formula that has antimicrobials in it and biofilm disruptors. Now, the antimicrobials in there, in my opinion, don't work as well. Like, they're not as strong as essential oils, but it is a nice kind of pre-made formula. It's just not over the counter. I have to get it from a compounding pharmacy. In terms of what I ask my patients to make is an essential oil-based nasal spray. So they're basically using diluted frankincense essential oil as a rule, combined with sterile saline, and then spraying that up their nose. I know folks always have questions about like how much, and like it just really depends on the case, and there's certain kind of different dosing for different patients and their sensitivity levels and stuff like that. Some clinicians like Dr. Krista do talk about dosing. I'm just, here in Canada, we're quite limited in terms of what we're able to talk about in terms of anything that might be construed as dosing recommendations over social media. So I won't get into the specifics of it here because I can't, but the long and short of it is a diluted frankincense preparation can work really, really, really well. I have seen some patients come in with iodine-based sprays. I believe there's also one that I think has thyme in it. Whenever I look at the concentrations of those over-the-counter formulas, they're generally quite low. So I do the calculations, and compared to what I'm using generally for essential oil-based nasal sprays, the concentrations are quite modest. Or patients will come and say on like X Clear or like some type of a xylitol-based spray, and like xylitol is all well and good, and some patients do really, really well with it. But I just have so many patients or I've had so many patients over time where they're using something like X Clear, or they're using an over-the-counter, iodine spray or something like that, and it just is not meeting all of their needs. So then we up the ante to an essential oil nasal spray like frankincense, or we will sometimes upgrade it further to like using a nebulizer with diluted essential oils in it, and that will pack a lot more punch. Like that can work incredibly well where the others don't work. Now I'm sure there are lots of folks out there that do really well with the over-the-counter sprays, and they're all better, so they don't bother ever coming to see me. So I of course am seeing kind of a biased subset of the population, people who have not got better, but that's just been my experience so far. So I think that with some of the over-the-counter preparations, I'm sure they're helpful for some, but I like the home brewed diluted frankincense essential oil. That's kind of my bread and butter, but sometimes we do need to up the ante to a nebulizer. And then sometimes folks have, very rarely people can't tolerate frankincense. They're like, oh, if I smell another waft of frankincense, I'm gonna, lose my mind. And then there are other essential oils that we can use as well, like diluted tea tree essential oil or lavender essential oil and things like that. Just we have to be kind of cautious with the essential oils we use, because some of them are really toxic, really caustic rather. They can, I suppose, anything can be toxic at a high enough dose. Anyways, could be really caustic. For example, I tried a thyme nasal spray on myself once, and it felt like battery acid going up my nose. It was absolutely awful. Whereas like 10 times the amount of frankincense, I can tolerate that no problem. So certain essential oils they pack a lot more of a caustic punch than others. If you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And if you have any questions or comments on these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.